Hey, welcome to The Explainer. Today, we are tackling a big one, something that so many students and families navigate, developmental learning disorder. I know, it can sound pretty clinical, maybe even a little intimidating, but we're going to break it all down, what it is, how it's spotted, and most importantly, how we can build a world of real support around the kids who experience it. To really get this, we have to start with what it feels like. Just try to put yourself in their shoes for a second. The rest of the class is moving on, but for you, it's like trying to make sense of a blurry sign. This quote just nails it, right? The real burden isn't just about a bad grade. It's the constant frustration, that nagging anxiety, and the sheer emotional weight of the struggle. So yeah, that internal struggle, that's our starting point. Before we dive into any of the clinical definitions, we've got to look at how these challenges actually show up on the outside. Because this is about so much more than just what's on a report card. Think about it. A kid who's struggling isn't likely to raise their hand and say, "Excuse me, I'm having difficulty processing this information." No, you see the signs. It might look like just visible frustration. Or a kid who suddenly gets really anxious about going to school. Maybe they just avoid homework, like the plague. Sometimes it even comes out as acting out, not because they're defiant, but because the task in front of them feels absolutely impossible. These are the clues that tell us something deeper is going on. So when you see all these behaviors, it begs the question, right? If these are the symptoms bubbling up on the surface, what's actually happening underneath it all? To find the right kind of support, we first have to understand the cause. All right, so let's get into it. Let's decode this disorder. This is where we get into a clear definition and start to unpack the different things that can actually cause these learning challenges. Okay, so here it is. At its very core, developmental learning disorder is neurodevelopmental. That means it's all about how the brain develops and gets wired. And here is the absolute key part. These are difficulties that stick around despite adequate intelligence and instruction. So let's be super clear. This has nothing to do with how smart someone is or how good their teachers are. It's a specific neurological hurdle in picking up skills like reading, writing, or math. And getting this right is it's everything. Because we have to tackle some really harmful myths. What this is a neurodevelopmental difference. It's about how a brain processes information. What it absolutely isn't is a sign of low intelligence. It is not a result of laziness or a lack of trying, and it's not caused by bad teaching. Understanding this is the first real step to getting rid of the stigma and actually helping. So, what's behind it? Well, the truth is, it's complicated. There's no single easy answer. What research shows us is that a few things can play a part. There's often a genetic link, meaning it can run in families. We also see specific differences in the brain's development, and sometimes things that happen before or during birth, or even coexisting conditions like ADHD, can be part of the picture. Okay, so with all that in mind, how do you go from just suspecting something's up to actually knowing for sure? Let's walk down the path to understanding and look at the careful assessment process that leads to a real diagnosis. And that leads us to maybe the biggest question of all for any parent, teacher, or student going through this. What does the path to real, meaningful support actually look like? How do we get from just identifying the problem to finding strategies that are actually gonna work? Well, the journey to get an answer is really thorough. It's not some quick checklist. First up, it starts with a deep dive into the child's whole history, developmental, school, family, all of it. Then, specialists will do direct observations to see learning behaviors in action. That's usually followed by psychological testing, which helps pinpoint the exact learning difficulty while also confirming their intellectual abilities. And this is so important. The process also looks at the support systems at home and at school. It really is a 360-degree view. You see how that whole assessment process looks at everything? It naturally leads to the most effective solution there is, a team-based approach. Because for this to work, nobody can go it alone. It's all about the power of a team. And this completely changes the goal. We're not just trying to fix a grade or repair an academic skill. We're talking about holistic care for the whole person. It means, yeah, of course we support their learning, but we're just as focused on nurturing their emotional health, their confidence, and their ability to bounce back. And this is what that team looks like in action. It's like a circle of care. The child is right there in the middle, always. And then you have this circle around them, the family bringing that support at home, the educators making adaptations in the classroom, and then professionals like psychologists and nurses who offer that specialized guidance. Every single piece is vital. So what's the game plan for this team? Well, the goals are really well-rounded. Sure, boosting academic skills is on the list, but look at everything else. We're talking about promoting a positive self-concept so the child feels good about who they are. We're teaching them real coping strategies for when things get tough. And a huge piece is educating and empowering the family so they can be the best possible advocates for their child. Okay, so we've got the definition. We've got the team. Now for the really practical part. What do we actually do? Let's look at the real-world interventions that help build both skills and confidence. The support has to be super targeted, right? So if we're focused on emotional well-being, that looks like providing tons of emotional support and reassurance. For the academic stuff, it's things like remedial tutoring or special learning aids. To build up those coping skills, we're actually teaching them stress management techniques. And for the family, it's about connecting them with community resources so they're not alone. This is what compassionate support actually looks like. And hey, support isn't always about these big formal interventions. It's also about the smart everyday stuff. It's about finding workarounds, like using a calculator if a student has trouble with math. It's about changing the approach, like reading out loud to help with comprehension. And it is absolutely about using positive reinforcement and celebrating every single small win along the way to build that momentum. Seriously, if there is one thing, just one, that you take away from this explainer, please let it be this. The number one single most important ingredient for success is a coordinated team. When the family, the school, and the healthcare providers are all on the same page, talking to each other, working together, that's when incredible positive change happens. Because when that team really clicks, the whole story changes. It's no longer a story about managing a deficit. It becomes a story about building resilience. It becomes about creating a truly supportive environment where every single child has what they need, not just to get by, but to genuinely thrive. And that idea, fostering an environment where every child can thrive, it leaves us with a really big, and I think a really important question to ponder. What if we just shifted our whole perspective? What if we saw learning differences, not as problems that need to be fixed, but simply as a natural, normal part of human diversity? If we did that, how could we reshape our classrooms, our expectations, and our systems to help every single mind flourish?